Hi, my name is Dr. Rahul Bhargava, and today I will be talking about myeloma. This short film is divided into three sections, the 3 Ds as I like to call them: disease, diagnosis, and doctor's actions. The disease. Myeloma is a type of blood cancer that starts in the bone marrow, the spongy tissue found inside bones. This is where our body makes blood cells, including a certain type called plasma cells. Plasma cells are white blood cells that secrete large amounts of antibodies that are transported by the blood plasma and the lymphatic system. When these plasma cells grow out of control, they crowd out the normal, healthy ones in our bone marrow, and they gradually build up to form a tumor. In some cases, there could be multiple tumors and is referred to as a multiple myeloma. Symptoms of myeloma. In the early stages of myeloma, our body might not show any symptoms, or these can be very mild. In general, myeloma can cause pain in the bones, especially in our back, ribs, and skull, weakness, fatigue, feeling of very thirsty, frequent infections and fevers, changes in how often we urinate, restlessness, nausea and vomiting, loss of appetite, weight loss, numbness, especially in the legs. Diagnosis of myeloma. While myeloma can be difficult to diagnose, as it initially has few or no symptoms, a doctor will order to test our blood, urine, and bones. The doctor may also order some additional tests such as electrophoresis to test immunoglobulin, BUN, blood urea nitrogen, to check how well are the kidneys working, and a CBC, complete blood count, to measure and count the cells in the blood. To confirm myeloma, the doctor might want to do a bone marrow biopsy to check for myeloma cells. Doctor's actions. Treatment of myeloma. For treatment of myeloma, your doctor will refer you to a specialist called a hematologist. There are two main objectives in treating myeloma. Number 1, to bring the myeloma under control, and number 2, to prevent and treat problems associated with myeloma such as anemia and bone pain. To bring myeloma under control, the doctor prescribes a combination of anti-myeloma medicines that might include chemotherapy, steroid medicines that help destroy myeloma cells and make chemotherapy more effective, thalidomide or bortezomib that help kill myeloma cells. And in some cases, the treatment could include a stem cell transplant that helps our bone marrow to recover. We will talk about stem cell transplant in another video. And remember, blood cancer is not a death sentence.